Morning. It's about 24 hours or a little less after my takedown surgery at UCSF. Doing pretty well. I've got, as I mentioned, a lot of localized pain right around where my stoma used to be. Because this surgery involved them cutting around the loop of my small intestine and allowing it to drop back into the abdominal cavity. Um, so and there ended up being quite a bit of scar tissue there apparently that she had to kind of dig out before cutting out the small intestine. And so it's some pretty good pain on the scale they use. I'd put it at a 5 or a 6, and they had been giving me morphine drip like last time, but um, because it's such localized pain and the morphine kind of zonks out your whole body and is so quick acting. It hits you and you feel good and you're zonked out, but then it fades really quick. And it also has constipation side effects that aren't good for when I'm trying to restart my bowels. Because of all that, I talked with my surgeon this morning, and we decided that it made sense to put me on it's called Toradol. It's administered through the IV, and it's basically kind of an Advil derivative, non-steroidal anti-inflammatory. And people with the surgery apparently have good luck with it. So I'm trying that to see if it handles the pain without wiping me out so much like the morphine did. Other than that, it's I still haven't been allowed to eat or drink anything, um, and probably won't be able to start drinking clear liquids until sometime tomorrow. I've had a little bit of gas activity in my bowels, which is good, um, but not a lot. And other than that, it's just a waiting game of managing the pain, resting, and then walking around and moving around as much as possible because that helps the healing process for the wound and also helps to wake up the bowels. And I've got my little thing that I'm supposed to blow into every hour to prevent me from getting pneumonia. So I've been doing that. I should have mentioned, they just removed my catheter, which is not pleasant to have it removed, but it's nice to have it out. Now I just have to urinate within 6 hours, or they will put it back in. So hopefully that'll happen, and I won't have to deal with that anymore. Um, Other than that, it's just taking it slow and hopefully getting better. The wound itself, I saw it for the first time this morning. It's about, I don't know, 3 inches long. She cuts a big oval around the loop ileostomy so that when it closes up, it forms a straight line. Like if she was a circle, it wouldn't close up as cleanly. And she opted to staple it rather than leave it open as they sometimes do. And so I've got 6 or 7 pretty major industrial staples going horizontally across. Um, so hopefully that'll start healing up, and they usually remove the staples before I leave the hospital, so that'll be in the next couple of days. Um, so that's about it. Um, Hopefully we'll just keep on the right track and start doing some liquid diet at least tomorrow because I'm pretty hungry. Um, so anyway, I will keep everyone posted and let you know if anything exciting happens.